Welcome. You are about to experience a revolution in spine and back health. Here at one of our specialized physical therapy centers, our licensed physical therapists will introduce you to the advanced spinal mobilization instrument, an FDA-cleared medical device that empowers physical therapists to treat you more effectively, get better and faster results, target and focus their treatment all on a specifically designed state-of-the-art treatment table, ensuring both your comfort and maximizing the therapist's ability to perform treatment. The patented advanced spinal mobilization instrument has been in clinical use in the United Kingdom, Australia, and other countries around the world for over 5 years. Thousands of patients have been successfully treated, many traveling thousands of miles. We know that every patient and every back is unique and demands individualized and specialized treatment and attention. As a physical therapy center with a comprehensive and thorough understanding of the spine and an intricate knowledge of its function, we believe that the treatment of the back with the advanced spinal mobilization instrument delivers superior results.
In order to best understand the use of and treatment with the device, it's helpful to understand the normal anatomy and movement of the spine and its 33 specialized bones, the vertebrae, as well as the articulations or joints between each pair. The spine is divided into the cervical, thoracic, lumbar, sacral, and tailbone. Between each are discs and articulations that provide for mobility and flexibility. The spine has natural curves that facilitate function and has supporting and stabilizing muscles and ligaments. The healthy spine should be supple and elastic like the spine of a healthy teenager. With time, the spine naturally stiffens, with injury, sudden minor movements, or years of strenuous activity. Poor posture and poor fitness causes the spine to lose its flexibility and mobility as well.
We know that there are as many causes of back problems and pain as there are back sufferers. Yet all of them suffer from stiffness and loss of spinal flexibility and mobility. Whether you were injured, have chronic back pain, can no longer participate in sports, or simply have difficulty with daily activities, we are dedicated to the challenge of getting your life back.
Advanced Spinal Technologies.
Every year, over 25 million people in the United States are diagnosed with back pain. Many have bulging or herniated discs. Back problems are also the leading reason for visits to neurologists and orthopedists. It is the most common cause of job-related disability and a leading contributor to missed work. Pain or disc problems are usually due to back injuries such as a motor vehicle accident or a fall, sudden minor movements or years of strenuous activity, poor posture, and poor fitness. A smaller percentage follows other medical conditions such as arthritis, osteoporosis, infection, joint and disc abnormalities, degenerative processes, or spinal stenosis. Regardless of the cause, most back pain sufferers seek medical attention. Physicians typically recommend conservative treatment, including rest, ice, pain relievers, and muscle relaxants. Patients with pain for more than 3 to 4 weeks often receive injections and are referred for physical therapy, pain management, orthopedic, surgical, and even chiropractic consultation. Sadly, most patients get little or no relief. They feel as if they're in a revolving door of unfulfilled promises and getting nothing more than Band-Aids for their symptoms. Some give up seeking medical attention and live with the pain, while others choose surgery like spinal fusion or seek other desperate measures. However, if given the option, most patients would choose a conservative approach such as physical therapy for the relief of their pain. Unfortunately, today's manual physical therapy offers only mild to moderate results. With the assistance of our device, our physical therapists can achieve effective and long-lasting results for our patients.
The device consists of a handset with 4 moving pads. The pads gently move in an alternating fashion at different settings. The device has built-in safety features that prevent the pads from applying too much pressure. If resistance is met by the applicator pads, treatment pressure is reduced automatically. At first, the joint may be stiffened or fixed. With treatment, mobility is restored.
Almost 50 years ago, a technique known as spinal mobilization or the gentle passive movement of the vertebrae to restore flexibility and mobility, became a regular part of physical therapy for back spasm and pain. Unfortunately, this technique is difficult to perform and uncomfortable for the patient. However, with the use of the advanced spinal mobilization instrument and our specialized state-of-the-art treatment table, the therapist can now easily and effectively treat your entire spine, not just the affected area, and perform targeted and precise spinal mobilization, and every patient reports a comfortable and satisfying experience. In addition, as you will see in a few moments, the device also incorporates the stimulation of paravertebral spinal muscles.
Treatments are performed with patients lying on a specially designed treatment table providing gentle passive traction. The therapist will ask you to put on one of our treatment gowns and loosen or unfasten undergarments to prepare for a treatment. In order to make your treatment more comfortable, the therapist will use a small amount of hypoallergenic gel over the treatment area. Because each back is unique, your therapist starts every treatment by examining and assessing your entire spine. Treatment with the handset then begins at the base of your spine. The device has 3 different modes of operation, and your therapist will adjust and alternate through all 3 depending on how your back responds to the treatment. The first mode, or the introductory mode, prepares the back and helps to relieve muscle spasm. The setting lasts for 15 seconds and serves to acclimate the patient to the touch and feel of the handset on the back and spine. The second mode, or the reflex mode, provides short taps to the spinal muscles, stimulating and waking up diminished spinal muscle reflexes to help stabilize and support the spine, improve posture, spine and back health. The third mode is the joint mobilization mode, where the therapist moves the joints through their natural, normal and intended range of motion to restore flexibility, mobility, back and spine function. Treatments are generally performed every other day, depending on your response. Improvement is a gradual process, and most patients complete a 4 to 6 week course of treatments and return for maintenance treatments several times a year to preserve flexibility and optimal spinal health.
Following a treatment, you'll be spending some additional time with your physical therapist. It is important to let your therapist help you off of the table, as you may feel a bit lightheaded following a treatment. Do not twist or bend immediately following a treatment to allow your spine and back to get accustomed to your new and healthy posture and position. In front of a mirror, the therapist will point out improvements in your posture and begin to demonstrate standing and walking tall exercises.